everybody is the same, but we are very similar to our brother and sister, for indigenous. We belong to different part, and we are very, very different based in where we came from, but I wanted to tell that in the state, there are many, many indigenous from Mexico, Guatemala, and we have also Garifunas that are like Caribbean, that they live in the Atlantic, from Honduras, Nicaragua, and the other way. In our organization, we have representation on 9 different languages. We have a Nahuatl, we have a Triqui Alto, Triqui Bajo, we have a Mam, we have a Purepecha, and we have a Purepecha, and we have other language that I don't come into my mind. We are a very diverse community, and there are a lot of need in our community, but the one that I wanted to tell you is the one that you all know. It's about the COVID-19. The way of this disease has impacted our community is really a disaster. I don't know how to call it. It's something that we didn't expect. In addition to all the social determinants we have been carried out since we were invited to this country, or like my brother Mexican say, we never crossed the border crossed us, because many places like California and all of those that have a Spanish name used to be part of Mexico, and in war, they were, and then we are still here forever. However, we are marginal, and from the marginal, the people that have been more marginal is the people that is indigenous, because when I applied for grant, for example, and it's something that I wanted to bring to you, I applied for grant for Latino, and I put it the indigenous. It's like they don't even mention the indigenous, it's a very lack of respect. One time I tried to apply with indigenous American Native, because my indigenous people is all coming from the same gene, and we are also American Native. We are more American than the American that come here from Europe, because we live in already in America, But I was very surprised, because I applied for a grant with a nation here, and they say, oh, they are not native from America. Then I say, I was very frustrated, because I represent the population, but they are not classified Latino, and they are not classified indigenous American. Then what they are? Because of that, they live in really in the battle, and because you have a lot of man, you have been seeing them, they have a more similitude with our indigenous. They have a strong respect for the land. They have this respect that we, as I don't understand them. I believe any of you that is a indigenous understand more than maybe I can understand, because we were colonized and we are more European with indigenous, and they preserve the culture, and they are very proud that either the invasion and colonialisms that we suffer, they still stand up, with the language, with the religion, and with all of that. The principal problem that we identify, there are a lot of Latino in Washington. This is because there are a lot of farm workers. And that 60% of all our income come from the farm. Most of them are working there in this field. There are also other essential working. They working a lot in restaurants. They working in the places that are underpaid. Some of them have their own business, like little restaurants. Some of them have their own business in cleaning. But it's not mean that all the Latino can be put together. They are different generation. The first generation, they have a lot of limitation, like everyone that come in first time, language barrier, economic barrier, lack of understanding how is to live American, lack of connection or getting resources. The second are like the second generation. Some of them doesn't identify with the first generation. They are struggling, then try to get a identity. And the third generation, almost they lost the language. Especially in the Latinos, the first generation are very protective, and they feeling that either Hispanic children or daughter learn English, Spanish, they won't have job because they will have a accent. And then they try not to speak in Spanish with the children because they don't want it. They have the same lack of opportunity that the first generation do. And this is a problem from us, because really when you speak two languages, you always have more qualification than other people, you know. The principal problem now is that because this multicultural, it's very difficult to do a message that coming to all the Latinos, you know. Some people believe that you have only one language and this is the Spanish, they will be covered all. No, like with the vaccine, there are a lot of misinformation outside, you know. Either the vaccine will be available for our Latino, they are not going to take it maybe. And we need to do a lot of effort to invest money to reach this population, not only in Spanish, but in more than 20 languages that you have in the state. And another thing is, some of them are scared, you know, Latinos that have some documentation, they living with fear that your information has been taken and shared with the government. And this is another thing, you know, because, but they living here forever. And one thing I'm going to tell them is like farm workers are here and they get payment between 10,000 and 25,000 per year. They don't have any, and this is next slide. Maybe you can put the third slide. But the third, we can pass and then we can come in. Like agricultural workers, you know, they work more than 40 hours, especially in the season. Sometimes they work 10, 12 hours. They work all year because either, you know, the season for the apple is the big places, farmers, they have apple all year and there are a lot of work to do. One of every apple that all the work consumed coming from this play, you know, 107 apple, and then you can see all the people that were in only this field. And most of the time, they don't have insurance. They only 10% coming inviting to this country with the visa H2. The other percent, 90% doesn't have documentation. They were in the inclement weather, too cold, too free. Why they get COVID-19? Some of them living in trailer and they put like 15 men together or putting 3 family together. And you know, they don't have a food security, etc. And I wanted to tell you the history of 2 of them and finish them because I wanted you more questions. The history of one community health worker. He worked in cleaning. He contacted me in March. He was from King County, but doesn't matter. He was from King County or Thurston. His history can be duplicated in all the state. When he went to the hospital, because he didn't have insurance, they don't do the test. That was in March. He tried to go 3 times to the hospital. They say keeping in your house. He had really limitation to breathe. He was with fever. He was very bad, and he had to go to work. He doesn't have a car. He had to take a bus. In the bus, they are Latino, white, African American, anybody there. He contaminate all these people, okay? And then he contaminate the people maybe that he cleaned the houses. Because for here is no choice. And he was trying to get some medical attention and he didn't do, you know. And this is, I am very enthusiastic about the vaccine, but it's a bigger problem than a simple vaccine, okay? It's social determinant of health. I have another case of Pierce County. They have one community health worker, 18 members of the family becoming with COVID-19. And either those people work with the community to tell them keeping distance, using face masks, clean your hands. The reason they get contaminated is because they don't have the choice to be like us here. They have to go out, they have to work because who pay? And the other problem we have, now we have a lot of people homeless because it's not only that you have the COVID-19, but what happened when you survive the COVID-19? You know, I have one lady that was for Tri-City. She was 35 years. The mother is 50 years. She cannot work more because when you are a migrant, your body is completely destroyed when you are 50. The lady get it, COVID-19. And 1 month after the COVID-19, she had a stroke. Now nobody work in that place. But there is no any assistance for the people, you know. And this is only to talk about migrant, but I wanted to stop here because I don't want it to boring you with all my history. And I wanted to hear if you have a question. I can talk about all the needs. The needs, most of the health needs in the community is hypertension, diabetes, obesity, you know, fair to go to places when they can have attention. And sometimes the family are very mixed family. You know, you have a first generation, we have no paper. Second generation, they were born here. They see the struggle of the first generation. They are very limited opportunity for our. Do you know most of the Latino when they graduated from high school, they have to work. You know, they go to the street. They don't have because they don't have a system support. Also, the family when they come in here, actually they don't have there is no for them. Some of them doesn't understand the importance of education, you know, and this is something opportunity that we have to working with the education system to giving them. There are a lot of Malika. I know there are a lot of problems in the state with opio, you know, opio. And for our Latinos, it's a macho culture. The fact that many of them are losing the job is very bad for them. And the refugee, they get alcohol, you know, and it's very frequent that, and also violence, domestic violence. And there are a lot of problems in the community. And most of the women that are, and children or family affected by domestic violence, they don't tell him because the same problem, you know, the man is the one that maybe provide money. And if you put him in the jail, who is going to provide with the money? Then it's a very black perpetual thing. I'm going to stop here.
Thank you so much. Were you going to say something, Malika?
Pat, we were holding questions till the end. I'll hold my questions.
Okay, perfect. Yeah, and also before, I don't know, you are more interested to know about, they are, the field when you have more migrant in the state is no agricultural, but they are a lot of people that we have in the cleaning industry. We have been provide direct and indirect services through the organization. We helping 400,000 families to giving directly economical support around the state. And the profession that they have, name it, were everything, you know, from people working in the field to people working in the hospital. We have a lot of dreamers, you know, that they are working in the hospital, and either they are there in the front line, they still have the problem that they don't have a documentation, and they also afraid, and their family, you know, they living maybe in a small a room with the daddy, the mommy, and the other people, and the dreaming have a very heavy bag to carry, because sometimes they are the only one that provide with a stable money to the family. And now they have to thinking about working, sustain the family, and either if they wanted to pursue a career, it's very difficult because of the economic condition. But I can talk about, it's a lot of need, and I know that Julio is going to talk more about the behavioral need. And women, indigenous women, as you see, there are many Latina indigenous women, they don't go to the prenatal care. There are a lot of low births, and also there are a lot of deaths because, you know, in the state of Washington, African American and Latinas women are the ones that are statistic for maternal child support. And many of those are things that can be preventing. You know, some of them were women with obesity, addiction, or people that live in insulated. I wanted to invite you, you know, to you put the second to go to my website. You can see the program that we offer. Most of the program is to increase the quality of life and support community health workers. We have a program about pesticide, prevent pesticide exposure in the environment and in the people. We work about oral health because oral health is a social determinant. Oral health is in the, you have a problem how to pay for the house, how to bring a plate of food or to your children. You don't care about oral health. You know, this is like a luxury thing. And we have a lot of information that you can be there, but we represent more than 60 different organizations, and we work based in the grant that we have. And we have some publication that I couldn't put it up, but I can share it with you after this day. Thank you.
Thank you so much for that great information. And I think what we'll do is we'll have Julio do his presentation, then we can talk about questions and kind of have a discussion around that, because I'm sure a lot of the questions, maybe both people will have good answers and different answers too. So next we have Julio Rios from Cielo. Welcome. And do you have a presentation?
I do, and I don't. If I can get access to share it, that would be awesome. But while that's been done, I am honored to be speaking in this nice forum. It's nice to see some of the faces and also be able to see everyone else here connected. And I am honored also to follow Dr. Ileana Ponce. Her work and the work of the organization she's presiding has been awesome. So there's not a lot I can add to the fact that she's one of the main individuals that have worked so much in the state for the Latinos. So I just want to commend her and her efforts. I don't have the pleasure to meet her in person because I arrived to Cielo in the midst of a pandemic, and all my relationships has been through the screen. Mm-hmm. But I cannot wait, as everyone else, to this pandemic to be over, and maybe we can have a nice cup of tea, or like from where I come from, I will have a carne asada for everyone. I'm Julio. I'm a Mexican immigrant. I arrived to the United States in March 2019, so I am quite new to the area. Although I have a different walk of life. I will say that I will be one of the few, very, very few privileged persons in Mexico to have a degree, and also, have studied the language that I am using right now here. So ever since I left my manufacturing work, I worked for 8 years for General Motors. I was tired of it and I wanted to make a difference. And I just doing a very few introduction. I decided to start working in nonprofits in Mexico for underserved youth. And the thing is that everywhere you go, it has different levels of depth, but the youth, and there are also marginalized people everywhere in the world. And it's awesome to see that although you see a lot of darkness around you, you also see a lot of light. It's such a meeting like this that we're able to see different things. I would like to give a different approach. I believe that Dr. Ileana Ponce gave a very good, panorama of what the Latino community is facing right now. I'm just going to talk about a little bit of what Cielo has been seeing. One of the things that I had to do, because I am new to the community, I had to get acquainted with the community, walk as much as I could the situations that our community is living. I had to use one of the most important values I think someone can use nowadays, which is cultural humility. And that cultural humility is that even the fact that I'm a Latino, I cannot assume anything about Latinos. I need to spend the time with them to know what they're living and what they're going through right now. And something very important that I have been able to learn that could be probably extend to most of the Latino individuals is that for us, time is not money. For us, time is relationship. For us, you need to spend time in order to get the trust, in order to get what the information that you might need. So that's what we have been able to do. We had to stop most of our services and we start spending time in the community as much as we could. Of course, when you talk about education, there's huge gaps. the community that was already having a lot of issues navigating all the systems, now they face yet another new system where there was a language barrier, now was a technological barrier. So our team had to scramble everywhere when it has to do with counseling sessions, educational programs. We have to go and provide hotspots, internet access, and then be there advocating for the family. So I have just a couple of screens that I would like to share with you. And of course, you may be able to just let me know if I'm going too fast or too slow. But Cielo, these are three main characteristics, or the three main things that we believe as community: self-sufficiency and leadership. And we're thriving in the midst of uncertainty. So those are the three main aspects, and we see it on a like we're walking first. The very first thing you need to have as an immigrant is community. There's something so real, which is cultural exhaustion. And I personally lived it when I arrived to the United States. There was a point on the day that I could not hear any more English. I was so exhausted. I couldn't. So I just wanted to have a place where I can hear the language. It was like music to my ears. Just the smell of tortilla or carne asada will bring like, oh yes. Oh, I didn't want to smell any more McDonald's. I didn't want to see a freeway. I just need someone to say hola. And that would you almost bring tears to my eyes. So just bring that community is the very first step. And that's where it comes from, cultural humility. And then after you have provided the community, you can start talking about self-sufficiency. When that exhaustion is gone, now you can start working through that. And then of course, leadership talks about when an individual is ready to bring others to the table. So when I'm talking about the wraparound process, and I'm here, of course, I'm gonna talk the challenges, but first, this is what Cielo was doing. This is like the Cielo funnel. If you want to think about something, we have a lot of outskirts programs that we're doing: family workshop, COVID-19 outreach. That's where we got the most information that I'm going to share with you. We have anxiety and depression webinars. We have educational success workshop, direct services. That's so important because, as Dr. Ileana Ponce said, we are living in the midst of a catastrophe. When the moratorium is over, I don't know what's going to happen with individuals that have not been able to pay rent. And there's so much disinformation about the Latino community. And this is not assumption. This is something that I have been able to hear and listen from the mouths of the people that are actually suffering right now. So educational advocacy, direct services, we've been able to distribute funds, emergency relief funds for families and individuals in Mason County. Those funds have been able to be distributed because of loving people, for example, that were able to say, you know what, I don't need my stimulus check, I'm gonna donate it, and I'm gonna donate it for an individual that actually needs it. We have sewing classes, educational advocacy, food bank. And what happens is whenever you're having those conversations, then you start listening to deeper needs, such as mental health needs, such as educational needs, such as needs for advocacy for crime victims, for sexual assault and domestic violence. And one of the very important things is that there's so many things that we say of our own community as Latinos, and sometimes you don't understand that, yes, we might be, for example, when you talk about behavioral health, we have some kind of like, we don't like that. We think that, you're weak if you go to seek for mental health, but there comes a point that when an individual is ready to get healing, now you have the biggest obstacle. They're not eligible. Even though they want to have mental health, they want to heal now, because they're non-documented, probably they don't fit in a report of success of the multiple nonprofit organizations that are trying to help them, because this is not part of so many organizations, maybe on the government level, that are trying to help people. So there's when it comes to the point that you're hearing their voice, and right now as I'm speaking, I feel the huge weight of the multiple conversations that I have had in these couple of months that I've been working for Cielo, and I am now responsible for portraying that voice correctly. So I'm feeling really responsible right now to be able to show you that. So this is like just a picture of what's going on and how we've been able to get the information that I'm talking to you right now. We've been hearing the community. We have stopped all our assumptions, even though we're Latinos, and say, what's going on? Please tell me. I don't want to bring my bias into this. let me know what's going on. One of the amazing tools that we were able to be part of, and we're so honored to be part of, is the Washington, California, and Oregon Farm Worker Study. And of course, when you hear farm worker study, that's also so true what Dr. Ileana Ponce said. Yes, we have much more individuals that are not considered only farm workers. We have in the cleaning industry, in the minor manufacturing industry. But of course, what I'm thankful about this study is that it gave us the questions coming out from the University of Washington, and then we build them together to be able to get the most information we could. And then we apply those questions to other individuals as well that may not qualify as farm workers. So what's going on right now? Well, the first thing is that there is the big saying that the Latino individuals, we're getting sick because our culture is, avoiding for us to be responsible enough. They might say, these individuals are not washing their hands correctly. They don't have enough hygiene culture. And to the contrary, the people in the farm in the farm fields and also in other places are getting sick just as because Dr. Ponce said, because they do not have the choice to stay at home. And then when they are working in several places, those places do not offer the proper PPE or the space in between them. So they are getting sick because they also live in a different way. They live in places where they have multi-generational, setting. They have a congregational setting when they're living. So just like Dr. Ponce said, one individual come home from work. And this is very interesting that we heard in one of our conversations that we have. We have multiple farm workers and other workers in other areas as well, that they know to protect themselves because they come from the fields having in their clothes maybe pesticides, and they have been able to clean themselves correctly. So they told us, you know what, now in the pandemic, I do the same thing. When I arrived to my home, I had to shower, I had to leave my clothes outside because I was afraid before because I have pesticides in me, but now it's the very same thing. But we are getting sick because one individual gets sick in the workplace, and I'm working like 3-2 feet away from them, and it doesn't matter, you cannot wash this thing away once it's inside of your lungs, it's inside of your system. So what I'm doing is I'm just bringing up those things that are coming from the houses. We have been talking over the phone. Another important thing we did during the summer where the numbers were, low, we start going to a flea market in Chehalis. And this is very interesting. You might ask, why is Seattle doing in a flea market in Chehalis? Well, exactly that. We had a booth with information about COVID because we had a contract with the Department of Health statewide. And also we had a contract with Lewis County Public Health and Social Services. And we're just distributing information about COVID. And the interesting thing is that the community is very aware of what they have to do, but they don't have enough options. They don't have options to do things differently. For example, when, they were offering some help for you to, you can leave your home and you can go probably to a hotel where you're living your convalescence of COVID. And one of the very heartbreaking things that I heard is that, my dad or my mom, they didn't want to go there because it brought them memories about the detention center. And we decided to stay home and everyone gets sick. So we were able to portray this information so we can find a different way to provide for these families. So of course, in the midst of this, and that's something that in the midst of this apparent darkness, there's a lot of also hope. There's a lot of hope and a lot of action, not only hope, to be able to overcome these situations within the pandemic. Of course, once the pandemic is over, hopefully soon, we don't know yet, but there's still a lot of obstacles in eligibility. We need to be able to advocate for immigrants because they have the right, because they're humans, to access health. Another very important aspect, as Dr. Ponce said, is mental health and behavioral health within our community. Our programs, we have been able to continue them and offer assistance and advocacy for immigrants and also indigenous people in different places. And Canjobal, MAM, those are the main languages that we have been able to give access. but also we know about Triqui and Purépechas and other languages that are spoken. And one of the main things that we have seen is that they don't necessarily speak Spanish. And then most of the things when they are seen and say, okay, you're Latino, okay, I'm gonna give you something in Spanish. And I say, well, I don't speak Spanish, I speak English and I speak Mam. And I don't really wanna speak Spanish. I don't need to speak Spanish. So it's about access, it's about humility, it's about asking, it's about saying, I don't know. That has been the best phrase that I have been able to find in these days. I don't know, let's find out why, let's find out what's happening right now. And just having those conversations. And let me tell you, when you approach individuals with this level of, I don't know, but I want to help, you will find that they have the tools, they have the intelligence, and we have the energy to thrive. We just need an equal ground. So I hope this is helpful. I just wanted to have, a different approach of what, Dr. Ponce did very, very great, but just to be able to share what I've been able to hear and also live in the midst of this pandemic. And of course, I'm happy to try to answer your questions when you get them. Thank you.
Thank you so much, Julio and Ileana. Does anybody have any questions to start or topics that they want to discuss? I do. So we mentioned COVID-19, and one of the things that I've been curious about is what are some of the best ways to get information about the vaccine out to the non-Spanish speaking individuals? Because I know we have Spanish signs and English signs, but what are, as far as access, and getting them thoroughly into the community, and maybe that's working with CLO and working with our local organizations, but what are some other ideas?
Okay, I can tell you there are many ways. I wanted to see I can share my screen to display a model that we're using, because like Julio say very eloquent, and I love everything that you say, Julio. Is we need to be humble to know that we cannot do everything. We have to trust in our trusted member of the community. And I have hold on. One of that is what we have been done is to work closely with trusted member of the community. Let me see, I don't know why it's, okay, let's see this, because we're changing recently the website, and this is why I experienced some issue with the website. But if you go to my website, I am very proud that, like Julio says, some of them is a spoken language. It's not either a language that you can write in. And what we doing to do that is to using the trusted member of the community, the leader in their community, to do the message and invite them to speak and to talking with the community, and also with the video. If you go here, those are a video in general in English and Spanish that we develop for them. But one thing that we do is we do workshop, and we asking them to speak in their language the message that we wanted. Let me see, this is here. And invite a member of the, and here, and we produce radio, TV, local radio that they listen. And for example, here you can see this we developed for the COVID-19. And you can see here we have a English, because some of them speak Garifuna, Spanish, Man, Canjobal, Parpecha, Triqui, and Mestizo, and Nahual, Mixtecos, is invited them, because you do want to sing when we do, and this is what the coalition do. what the thing that you do, and when you do that is you support a member of the community by inviting them. We compensate them to talk with their community and the language, and then this person that day will have some money that will help the community to buy the food. It's not too much because depending on the ground, but they are the one, they don't want to hear from me or for Julio. They wanted to hear from their leader in the community. And by doing that, we respect them, and one thing that many founders do that is a mistake. They're giving money to people, but they don't give the money to the community. And one thing I wanted to say you, they are a small organization like community health worker. We're using only community health workers. We compensate and we training the people that is in the community. It's to see when you get the funding, really, not because the person has a name Latino Community Association, that doesn't exist. It's mean they work with the Latinos. You have to see who they do and what they do, because many small communities that are with the community have been using with the COVID-19. And I'm going to tell you how. I know some communities receiving millions of dollars with the COVID-19. And you know who they're contacting? Me. I don't receive the money because I am nobody else, because I don't have a time, because I'm working with the community. I am not political, and I don't want it to be political. But I don't have a connection. Okay, they contacting me, Ileana, we need 5 volunteers. I say, volunteer? I don't have volunteers. Oh, we need them translate this, to do this. No, we have it then, and if you want to use them, our indigenous, you have to pay them 100 per hour for translating, because you help the community. Some of them disappear. You never hear them. They go to other small organizations and say, oh, you are going to work with us. We are going to give you 20, from the $1 million they receive 1,000, And this is, I don't know if Julio experienced that, but this is what I see, in the community. Looking for communities that are organized in the community, that really are working with the community. There are many of those. And many of those are not a 501c3, and this is a way to communicate. If somebody work with the community, they will know the community. I'm going to give you 2 examples. I get a 52,000 million mask. No, 52,000 masks. I contacting all my 12 regions in the state. I distribute all these masks in 1 day. That either was in the queue, I can send you the link of the channel. Why I cannot do that? I cannot do that. My community health worker do that. Hand sanitizer, the same thing. I received 28 for children. And 2 days disappear. The organization, one organization giving the care to one organization. I was calling 1 month before the deadline because they have a money that they don't give into a small organization like my organization. They give into the big organization. Because this is another, we have to be honest. There are a lot of competency. And people like us, we cannot compete with the big monster, I say, and we don't want to do that. I'm working with my community. I improve the life of my community with what I have. I am not in competency. My competency is to bring resources, to bring a hope to the community. $500 is nothing, but at least you give a hope to a family that day didn't have a plate to eat. Or another example, okay. So this organization called me, oh, you have to use this in 1 month. You have to give into the community money. My organization was not ready for the COVID-19. We do everything face to face because the community, like Julio said, was not training in computer. They don't know how to use Zoom. We have to spend like 3 months. We provide with computer to every leader of the region, and we training them. They are completely virtual. You can do it. People say, oh, these people didn't learn. You cannot imagine what is capable to do when you empower community. You don't have, this crisis about the COVID-19, the vaccine, they are. I have a 60 leader in the community. Nobody has contacted me. I either write the governor. I say, we have 60 people waiting for you for the outreach. And then we don't know what to do, but I speak up. But okay, these people call me and we give him $500 We only get the 10% for administrative to deliver the check to do that. Do you know how it's to giving money to 5 families that I don't have documentation? You have to go through many mechanisms. We don't ask them anything because our community health workers know them and they know if they need it or not. And then we provide with that in less than 1 month. Nobody can do that. Only the people that work with the community. If you go to the community, listen to the community, talking with the leaders, asking them who they wanted to support them, because there are mechanisms to do it. This is one of my 2 cents.
Those are very valuable 2 cents. Thank you.
Thank you so much for that. So what I'm hearing is that, and thank you for your work, both of you. And as a community health worker and a person who's done outreach for many years in this community, I am super grateful for the work that y'all are doing. And, vaccine uptake, we know that in communities of color, there's distrust because our bodies have been experimented on. And as Christina was talking about, there's language barriers. However, in Thurston County, one of the target populations for vaccine distribution are people that are non-English speaking. And so I'm wondering, so this is a question for the organizations, but also for the people that are representing Thurston County Public Health. Have y'all's organizations heard anything from Thurston County Public Health about getting vaccine out to the target populations that you work with? And then also, so Thurston County, is there a plan in place to work to collaborate with these organizations that are here? So the first question was for Ileana and Julio. Have you been contacted?
I didn't hear about any authority. I have been asking the Washington Department of Health and local authority, not just Thurston, but we feeling that nobody cares. This is what we're feeling as a non-profit organization. We see that many people, either in Thurston, have get the vaccine that they don't are in the phase. We don't know how. I am not going to say, but it's not getting to us. And this is why we are talking about social distance. It's about and it's very sad because first, it's a community that doesn't trust in the system. And the reason we doesn't trust because this kind of thing is happening. Right. Nobody has contact anyone in any federal qualified health center. And you know that because I work very close with either in Thurston to the people to telling we are in the phase 1. Nobody explained that to people. Where is the vaccine? And then when you are going to giving us, maybe myself, maybe I'm going to have the vaccine in 6 months, but telling me when and why. And because I am Latina. You create in the way that is not so transparent. The information is not helping the communities to trust in a system that always leaves Latino or brown people from the last. But we need to hear where is the vaccine and who is taking, because I can see people in my community that they are not doctors. Right. And they are white that are getting the vaccine. And I need a response for that.
Thank you.
I can just echo a little bit of what Dr. Ponce said. We have also been asking about it because of our work that we've been seeing with farm workers and other workers, but also for our advocates that, it's so hard to continue our advocacy work in doing some kind of like telehealth approach to it. And nonetheless, we have seen some of our staff getting sick because of it. And just as Dr. Ponce said, we also, it's evident that the phases could be, could be that they're not being respected, but I know for a fact that they're not. And then you have multiple workers that are basically sustaining the economy being ignored. So it is a little bit of disheartening to see this. And of course, I will say that we have also been contacted for a future maybe partnership to spread information about the vaccine, but not right now. And it's too late. And just as Dr. Ponce said, when it's the requirement is just, for example, for translation of information, whereas you cannot, translating things does not mean you make it relevant for no one. So it takes a long, more work.
Thank you both for that feedback. I'm hoping that our colleagues from Thurston County have a response.
Yeah, I'll give it a go. My name is Keely Marino, and I am the Homeless Prevention and Affordable Housing Coordinator. So at the very, very beginning of this pandemic, I was put on the incident management team specifically to work on issues around homelessness. Initially, it was to ensure that the grants that we received in March from Department of Commerce were distributed in a way that supported the system and those that needed it. And then it moved swiftly into quarantine and isolation. Katie Strozik, who's also on the call, helped me with that. I can say hands down that well, let me then say in July, I did leave that position. I left it because fundamentally I was having philosophical and ethical issues with the whole COVID process and how it was rolling out and response. So at this point, I don't have, I no longer have direct line of communication with how vaccines are rolling out. I'm receiving it often at the same time as we had a meeting last night. Some of that information was the first time that I had heard it. And so I think what that points to is not an excuse, but just a reiteration that the rollout of these things have not reached the homeless community, the senior community, the immigrant community, the Spanish-speaking community, the both of your organizations. So I can't necessarily answer for that, but I can say that I am deeply saddened by that, and will do what I can to punch up and hopefully someone will listen to me.
This is Katie Strozik. I also work with Keely, and I'm in the same boat with everything that she said. So not to repeat all of it, but same.
And then I'll put another question for Mason County. And from my perspective, and I'm not involved in COVID response in any way, shape, or form on the county level, but I do overhear things, and I know that we're getting information. It's changing rapidly. Oftentimes, Mason County had 6 days to put on a mass vaccine clinic, which is taking place on Saturday. My question is, has Cielo, because I know Cielo does operate in Mason County specifically. I don't know if your community health workers do it, Liana, but Cielo definitely does have a big presence here. Were you guys contacted by public health about the vaccine clinic, which is, I think, individuals 65 and over and people living in multi-generational households are the ones who are eligible at this point. So I know that we had like 2 days notice to get that out, and it was, I think, given out through the internet, through Facebook, which I have concerns because our county is extremely rural. We have a lot of people who do not have internet access. I used to live with an individual who has a flip phone. He's eligible, and using him as an example, I'm saying he would never know about this unless I called him specifically. So I think there's so many different issues going on, but was Cielo involved in getting the information out about the vaccine clinic that we have on Saturday? And if not, I don't know if there's still spots open, but
we were not. And of course, I am open to whatever is necessary to bring the voice out to the community. But yeah, to answer, no, we were not. I don't have that information with me right now.
And I wanted to say, thank you, Christina. I wanted to say this is not, we have to fight with a structural, system. All this system is no, either it's no, because I work in the government and for many years. It's not because you don't want it to do good. It's because the system is not created for us. It's intentionally created for benefit a limited number of people, like vote suppression, you know. The system is ridiculous. Okay, you go, community health workers are allowed to have the vaccine. You have to go to register. The registration in English. What the hell is that? Sorry, okay? How many community health workers on my community speak English? Please, 1, 10%. And then, you know, they asking many questions that I am undocumented. I want to say, oh, this is government. What they want in my question? You see? And then when you register, nothing happens. You inquire for what, and now you have my I registered people already from my organization. None of them get it. They are desperate because, like Julio say, how we can support you to outreach my community if my community is not protected? They are going to spray the virus rather than support you. They have to be in the front line. You know, it's like that. O sea, email is not going to work with our community. I believe it's a structural barrier, intentional, because you know we cannot apply. Sorry, this is what I think as a leader. It's no more excuses. It's no more excuses.
And you're exactly right.
Yeah.
And even though, I mean, and I say this as a person who formerly worked in government, you know, it's not enough to say that you can't do a thing or blame it on the structure. As people that are within the government, we have a responsive, or I don't work for government anymore, but I believe that it is the responsibility of government to care for the people. And I am concerned because it seems like the equity, and I'm saying this in quotation marks, guidelines for rolling out the vaccine are actually barriers to the most vulnerable people and the most impacted people getting access, equitable access to the vaccine. And if local governments that actually end up having the last say about how how these things are carried out in the community don't have the courage to critically assess what the situation is on the ground, higher level guidance is exactly that, higher level guidance. They don't know what's happening in individual communities and what that looks like in individual communities. And so that is why we have local control in Washington state to be able to decide how we're going to do that. And I'm pushing a little hard on this because it's something, I was also in that meeting that Keely described last night. And as a person who has done a lot in this community to make sure that people have access to the things that they need, especially the most impacted. Oh, thank you, Christina. Are you leaving? Oh, okay. Thank you so much.
Yeah, and I'm sorry to be leaving during this very pertinent conversation that I should be a part of as a local health jurisdiction government, but thank you so much for everyone. And
Christina, the government always do that to us. Don't worry.
Bye.
I'm kidding. It's a black joke.
Yeah, well, I have dark sense of humor and I understand the issues, but Malika, please continue because you have very wise and important things to say. So goodbye, everyone, and thank you.
Take care. Thank you. And, you know, as community members, and some people that on this call that maybe have a degree of privilege, it is our responsibility to put pressure on the government that says that they represent us in order to fulfill our values. This particular group, we focus on safety net populations. What that means are the people that are most impacted by a lot of the negative structures within our society and that are marginalized and left out. And all of us are very familiar with having to push in order to get things for the people that we serve. And this is another example of that. So I'm hoping that the information that people are getting today in the relationships, I would really encourage people to connect with Julio and Ileana so that we can try and move things forward in our community in order to be in alignment with the equity that we say that we want.
Can we